Hello, my name is Alexa Magstadt, and today I'll be sharing my project on small molecule KRAS inhibition in colorectal cancer. Colorectal cancer is a disease that has impacted the lives of many, as it is the third most diagnosed and second most lethal cancer for both men and women in the United States. Within these tumors, 30 to 40% contain a mutation in the protein Kirsten-Ratt sarcoma, or KRAS. KRAS functions like a light switch within cells. When it is turned on, it sends signals to the nucleus that encourage the cell to grow and divide. In tumors with mutated KRAS, this signal is constantly sent out, which encourages tumor growth. For many years, KRAS was considered an undruggable target because it lacks targetable binding pockets in its protein structure. This was the case until 2022 when Mirati Therapeutics developed a small molecule inhibitor called MRTX1133 that is able to selectively bind to mutated KRAS and induce cellular death by stopping KRAS signaling. This has been shown to be very effective in pancreatic cancer and is even in phase 1-2 clinical trials. However, its effects in colorectal cancer have not been largely characterized, which is where my project comes in. I started by demonstrating the specificity of KRAS inhibition in CRC, or colorectal cancer. In clinical settings, it's very important that drugs target diseases very specifically, because the more specifically a drug can target a cancer, the less off-target side effects it will have in healthy tissues in the body. To do so, I plated cells with differentially mutated KRAS subtypes and determined that there is a 245-fold increase in cellular death in the particular KRAS mutation I study as opposed to non-mutated KRAS. I have then performed further studies to understand the specific signaling pathways in cells that are implicated in cellular death after KRAS inhibition. By understanding exactly how a cell dies after we give it a drug, we can determine which pathways it will potentially use to develop a resistance to this drug over time. And then we can target these pathways synergistically to reduce the chance for recurrence. I've done multiple experiments using Western blotting, immunofluorescence staining, and phosphokinase array to determine exactly what pathways are affected in cells after KRAS inhibition. I'm currently working to further characterize these pathways and understand their significance in inducing cellular death. This has great relevance both in the lab and in clinical settings, helping patients. Hopefully, the results of this research will be in clinical trials someday, helping patients overcome colorectal cancer and other similar cancers with mutated KRAS. Thank you for listening.